Welcome back to Studio 3. Joining us this morning from Simpson Dental, we have Dr. Kristen Simpson. Great to see you.
Hi, good to see you.
Yeah. Well, talk to us about your in-house dental lab. What is this?
Yes, so we have our dental lab on site with 3 lab technicians. So a lot of times patients might not know the benefits that having this lab can bring to them as a patient. So I just wanted to go over some of the different ways that we use our in-house lab. So we have 3 lab technicians that work in our lab, and they can make pretty much everything that we use restoratively in dentistry. So that's a picture of our lab there with all the different machines that we use, and these are our lab technicians here. We have Millie, Jessica, and Judy are our technicians that work up our cases, and it just helps us to be able to follow each case all the way through by having it in our office with our own technicians. We can talk to them about the case, go over with them what we see with the patient, the way the bite comes together, you know, the look of their teeth, the way they smile, some of the aesthetics that they might need to know to make the case better. So it really helps us to have control of each step of the case to get the best results for our patients.
Yeah, that's great. That's a real plus. So talk about digital dentistry and what this is.
Yes. So digital dentistry has been a real breakthrough in dentistry. It's allowed us to do so many things better for our patients, to have better materials and easier treatment because we can scan with a camera in the mouth and not have to take impressions. So with this digital scan, we're able to design the crowns or veneers and then mill them out of a block of porcelain to get really great results.
Yeah. And what is implant-supported teeth, and how does this help a patient?
So implant-supported teeth are where you place multiple implants, are able to connect them together to support replacing all of your teeth. So that's how we can do the teeth in a day procedure. So you can either connect those implants together with something like a gold bar. So that's our laser welder that we use in the lab to be able to connect that bar together the day of surgery, and then add a clip inside of the denture so that it clips into place. So that's one of the ways that we do a removable type of implant-supported denture, or you can do one that's fixed that stays in all the time by connecting those together with a digital design and milling that out of the milling machine. So many different ways we can use what we have in dentistry today.
Yeah, is that what a contact is?
So the contact is when you have a crown and like the contact between the 2 teeth. So that's something that you would be able to repair in the lab, or repairing dentures is also something that we can do in the lab. So those are both ways that our lab helps us to be able to do things the same day, rather than having to send it out to a lab off-site to get, you'd hate to lose your denture for a day to a repair. So having our on-site lab to fix it that same day really helps patients.
Yeah, it makes everything a lot more convenient. Now, through the lab, will that also help with color correction? Can you all do that through the lab?
Yes, we sure can. So in dentistry, matching a single anterior crown can be very hard to do to get the characteristics and the color exactly right. So having our lab technician on site to be able to see the patient and match exactly how that tooth looks, where the changes in color happen, the different characteristics, we'll get a much better match on that crown so that it blends in with a smile and looks a lot more aesthetic.
And you mentioned teeth in a day. How soon can a temporary be given to a patient?
So we can make temporaries in the same day as well. So sometimes if you abruptly lose a tooth and you don't want to go without a front tooth, we can make a temporary partial in the same day to be able to replace that missing tooth, or do a temporary bridge. There are lots of different ways to give you back a tooth if, you know, the trauma happens or you lose a tooth, you know, to get it back very quickly in that same day.
Yeah, well, it's been interesting to hear what all goes on because you all have an in-house lab and how that works with your patients. So thanks so much for sharing this with us.
Of course. Thanks for having me.
Yep.